Hello everyone. So in this video we will be revising typhoid fever, that is the enteric fever, in one shot. Very quickly, okay? I will be skipping a lot of topics so that you can revise easily with this video. First topic which we are seeing in this video is antigenic structure. The antigenic structure, we have to just see three antigens, H, O and the VI antigens. H antigen is a flagellar antigen. It is made up of flagellin protein and it is used for motility. O antigen is a somatic antigen. It is made up of cell wall lipopolysaccharides only. It is present on the cell wall only, and yeah, that's it actually. H antigen is highly immunogenic. O antigen is comparatively less immunogenic. VI antigen, or the virulence antigen, is actually the least immunogenic. That's a misnomer. Second topic is pathogenesis. For pathogenesis, we have to see the entire, okay, let's start from the mouth. Okay, I will be ingesting some food. It should have at least 10 to the power 3 to 10 to the power 6 bacilli. This is called as the infective dose of Salmonella typhi, and it's significantly higher than that of its sister organism, that is Shigella. After it's taken into my mouth, it goes into my stomach. In the stomach, two risk factors are present. Okay, first is if the stomach wall integrity or the intestinal integrity is compromised. This can be seen in the cases of irritable bowel syndrome, for instance. Secondly, a chlorohydra. This is a second risk factor, that is a chlorohydra or use of antacids, which will increase the stomach pH or decrease the acidity of the stomach. Then in the stomach wall there will be epithelial cells. This Salmonella typhi bacteria has some antigens which we studied right now, HVI and the O antigen. They will interact with the receptors on the epithelial cells, and they will cause certain changes. Because of this, membrane ruffles will be formed. Just one second. Membrane ruffles will be formed. These membrane ruffles, for example, this is epithelial cell of the stomach. It will form like this type of a structure. This is the bacteria. It will engulf the bacteria completely, and then this will take inside. So the bacteria will enter inside the endothelial cells of the stomach. After entering into the epithelial layer, it will stay there for some time. Then it will start its movement towards the submucosa. So if this is our stomach, this is our lumen side, this is the inside side of the stomach. It will start its journey from the epithelial layer to the submucosal layer. Inside the submucosal layer, there will be a large number of macrophages which will be ingesting this Salmonella typhi bacteria. Then this is actually third step, that is entry into the macrophages, entry of the bacteria into the macrophages. After its entry into the macrophages, it has to induce certain changes in the macrophages so that it is not degraded by the microsomal or the macrophages enzymes, that is the lysosomal enzymes. After inducing those changes, that is it will cause certain genetic changes. It will also cause changes that will inhibit the release of the lysosomal enzymes into the bacteria, so it will be protected by that also. Then this will cause transient bacteremia. How it will cause this? Because macrophages are there, they will be leaving the organ and they will be entering into the lymphatic system. After entering into the lymphatic system, it will drain into the veins. And the veins are a part of the cardiovascular system, vascular system, right? So it will cause transient bacteremia, that is the bacteria in the blood. Then it will spread to other organs, it will seed the other organs. For example, the reticuloendothelial system, liver, spleen and bone marrow. It will start residing in these organs. It's extremely important to understand. Then it will cause permanent bacteremia because it has seeded these organs. It will slowly trickle, leak into the blood again and again and again, which will cause even further pathogenesis of the bacteria. This was the entire pathogenesis which we had to see. Clinical manifestations, I have made a mnemonic, that is a FRIBAN, FRIHBAN. So F stands for fever, R stands for rashes or the rose spots. Okay, they are basically the maculopapillary rashes. They are basically rashes or rose spots. I will be intestinal manifestations, intestinal bleeding. H will be hepatosplenomegaly. It's very important. In any question, it will be given. B stands for bleeding, intestinal bleeding, gastrointestinal bleeding. It also stands for relative bradycardia. It will be given in the question. In the clinical manifestations, it's usually given. A stands for ataxia. N stands for other neurological manifestations. Other symptoms are also there. For example, sweating, that we can see because of sweating, electrolyte imbalance will be seen, so it will also cause confusion, breathlessness. These are the important clinical manifestations. Again, I repeat, the mnemonic which I have made is FRIBAN, FRIHBAN. The lab diagnosis. So for lab diagnosis, we have to see for first week, second week, third week, and the fourth week. For first week, we can use blood sample for detection of antigens. For second week, we have to detect the antibodies. For the third week, we have to detect is stool culture, and for fourth week, we have to detect the urine culture for bacterial remnants. So first week is antigen. Antigen can be detected directly into the blood, directly by the blood. Second week is by the antibody detection. That is done by Vidal test or other tests also, but majorly we use for specifically for typhoid we have is a Vidal test for antibody detection. Third week we have is the stool test, stool culture. For stool culture, we have two types of agar. Basically, we have the highly selective agar and then we have the less selective agar. Highly selective agar include DCA agar, deoxycholate citrate agar, and XLD agar. Okay. For less selective agars, we have is the McConkey agar. McConkey agar. That is a less selective agar. This is actually stool culture. We can also use certain enrichment broth also for stool culture. For example, tetrathionate broth and the selenite F broth. For urine culture, we always use the McConkey agar. So we have done for all the 4 weeks. Lab diagnosis is complete. Again, some other specific tests are also there which we can see. Okay, so first of all, it is a motile bacterium. So it is it has a peritrichous flagella. It is a gram negative and a motile bacterium with a peritrichous flagella. This we have to explain in lab diagnosis only. Then we have certain tests, okay, for example, catalase, oxidase, indole, citrate, and the urease test. This bacteria is only catalase positive, rest all is negative. Oxidase is negative, indole is negative, citrate is negative, urease is negative, only catalase is positive. Then we have is the Vidal test. Vidal test is specific test for typhoid. It is used for detection of antibodies in the patient's serum. So basically we will be taking 4 test tubes, first, second, third and fourth test tube. We will be adding the serial dilutions of the patient's serum containing antibodies to the specific antigen that is present in the typhoid. After that, we will be adding certain antigens. 4 types of antigens are added: TO, TH, AH and BH. What are these? TO is basically the O antigen of Salmonella typhi. TH is the H antigen of Salmonella typhi. AH is the H antigen of Salmonella paratyphi A. BH is the H antigen of Salmonella paratyphi B. Why are we using these? First of all, let's just understand why are we not using O antigens of Salmonella paratyphi A and B. This is because O antigens share similarities and therefore we cannot differentiate between A and B paratyphi. That's why. So this is basically what we'll be doing. This was a procedure. Okay, we will be incubating it for 24 hours at 37 degrees centigrade, all the 4 test tubes, and then if a mat formation is seen at the end of 24 hours, we can infer that the test is positive. If a button formation is seen, it is negative. Now we can also see, we can also check whether it's O or H by just seeing the mat formation. Okay, so if it's a cottony, woolly mat formation, then we can say it is a H antigen positive, whereas if it is white, chalky, lumpy, then we can say it is O antigen. So yeah, that is then a very important thing is interpretation of the Vidal test. We have to write that also for Vidal test. In interpretation, we see that okay, in interpretation we will be seeing that for Salmonella typhi infection, TH and TO will be increased. Salmonella paratyphi A injection, TO and AH will be increased, and for Salmonella paratyphi B infection, TO and TB will be TO and BH will be increased. This was the interpretation. Treatment ke liye we don't have to understand everything. Okay, treatment are actually, yeah, the drug of choice you have to understand, that is ceftriaxone. CEFTRIAXONE. Ceftriaxone is a drug of choice for treatment of typhoid. For treatment of carriers, the primary, that is the gold standard, is cholecystectomy, that is the removal of the gallbladder, followed by ampicillin or amoxicillin treatment. This is a gold standard, but of course, no one would like to get the organs removed. So we also use ampicillin or amoxicillin along with probenecid for 2 to 3 months continuously. This will cause the accumulation of drugs in the gallbladder. Basically, bile se release honge, then it will get accumulated in the gallbladder, and this will kill all the bacteria. So no bacteria will be spread in the feces. This is a treatment for patients also, for carriers also. Ceftriaxone and ampicillin probenecid therapy. This was all about treatment. Prophylaxis. For prophylaxis, we have 3 main approaches. We have first approach is the treatment of patients and treatment of carriers. Carriers के लिए I told you cholecystectomy and amoxicillin treatment is a gold standard. Secondary treatment is ampicillin and amoxicillin along with probenecid. This is done for carriers. For patients, the same. Ceftriaxone has to be given, and then we have the patient should also get a stool sample done every 2 or 3 months. For at least 5-6 months, he should do a stool sample so that to ensure that he's not a carrier, he's not becoming a carrier even after treatment. And for patients, ceftriaxone is given. Yeah, for patients it's this only. For the patient's clothes, the soiled clothes with his urine or feces, they also have to be treated with 2% chlorine, or 2% chlorine or 5% cresol solution. This was the first prophylaxis. Secondly, we also have to maintain sanitation measures. So the food should be clean, the water should be clean for general public, so that the infection cannot spread. Third and the most important is the vaccines. So vaccines are usually not permanently effective. They are maximum they're effective for 2 or 3 years. Two major vaccines, actually third vaccine was there also. Oral vaccine was there. Now it's not used. Typhoidal, the name was Typhoidal. It was an oral vaccine, now not used because of adverse side effects and reduced performance. The two major vaccines now are VI-Repa and VI VI-Repa and VI CPS. VI CPS is VI capsular antigen, capsular polysaccharides. This is basically antigen, so we can use this also. This as a vaccine is very efficient for 2 years. VI-Repa is basically the antigen. VI-Repa is basically the VI antigen synthesized in the recombinant Pseudomonas aeruginosa. It's also extremely important, extremely effective. I'm sorry. And third is Typhoidal. Typhoidal is still used. Parenteral, that is a tab vaccine, is not used. So Typhoidal is used. What we do is we basically make certain changes in the Salmonella Typhi so that it cannot utilize UDP galactose 4 epimerase. If the Salmonella Typhi is not able to use this enzyme, then it cannot survive for long periods in the human host. Therefore, it will die. Maximum to maximum 4 to 5 life cycles will occur. This is enough to generate immunogenicity, and then it will die. So this will generate immunity in the patients. Prophylaxis of typhoid should be done for people, common general people who are going for melas, rath yatras, or are going to endemic areas for typhoid. That's it. Thank you.